and we'll be going over the Epi Toolkit today. But while we're waiting for folks to join, if you all could just go ahead and we're going to bring up a poll. It talks about what your role is related to epidemiology in your organization, and just have you answer that for a while. And we also over in the chat have a link for you to download the Epi Toolkit. So if you've joined, go ahead and download that because you'll want it later as we go through the toolkit. So our poll is up. See some of you already answering. Got a couple epidemiologists, evaluators, epi work group members. And if you marked other, go ahead and list in the chat what your role is, just so we can see what role you play. So far, it looks like mostly epidemiologists and evaluators, totally expected for this call. We've got a program manager, awesome. This webinar today will be very important for program managers as well in terms of how you are going to mentor your epidemiology staff. So good to see you. And Scott says health department administrator, awesome. Cassidy says grant data management, very good. Scott, would you be so kind as to list the link again? Yes, and we will be posting the link for the toolkit throughout the chat today. As you're looking at your screen, it kind of disappears in Zoom as you start moving through the chat. So we'll continue to do that as we go through today. And Dia has posted the link again to the toolkit. So make sure to download that if you've just joined. I see a few new folks. Glad to have you all here today. Again, I'm Nicole Shaneborn, and I'll be leading you through today's Lunch and Learn. While we're waiting for folks to join, if you could go ahead and fill out the poll about your role. And then if you do mark other, please make sure to list in the chat what your role is. So we've got a prevention coordinator. Go up here. Yeah, so we've got some folks from the coordinator perspective, administrator, manager, great. Sarah, also prevention coordinator. Awesome. And it's now right at the start of our Lunch and Learn, and we do have a pretty quick timeline today, although we're going to take time to walk through the toolkit and have a lot of discussion. So we will probably start pretty promptly. I'm just going to look and see how many folks we have joining us. I think we're doing pretty good here. And so far, it looks like 25 out of the 32 of you have participated so far in the poll. So if you haven't had a chance yet, please complete that poll about your role. So the majority of you definitely leaning toward the epidemiologist. And we also have many marking other, and it seems like a majority of those are managers, administrators, prevention coordinators, data coordinators, good. So we also have some follow-up chat to that poll. And I'm going to go ahead right now and we'll just end the poll and go ahead and share the results here. We've got 31% with epidemiology, so about 1/3 of you. Evaluators, hi evaluators, I'm an evaluator too, at 19%, good to see you. And we have a program manager role at 15%, Epi work group members at 19%, good. We'll be talking about the Epi work group today too. And we also have about 1/3 of you that have marked other, and I see a lot of administrators there in the chat for that other role. So our next chat questions are going to be, how long have you been in that role? So we'll get to see if we have some newbies here or some long-termers like myself. So Dia has just posted that question in the chat. And you can also start putting in your name and where you're from in the chat as well. So we'll kind of keep the chat going for a minute here. Mindy says 4 years, 6+ years, less than a year. Okay, new faces, got a wide range. So it looks like right now we're ranging from about 2 years to 6+. So kind of that mid-level range, right? Where you've got some experience under your belt, but you're still wanting to learn more and improve, and that's awesome. That's what we're going to do here today. And we do talk about how this toolkit is really for newer preventionists, but really this is important for all epidemiologists, because as you know, you get in the middle of this, sometimes you have to start right away getting into your role and you don't have time to really focus on some of these things. So it's a good time to take a step back and find some additional tools and processes that you can use to go forward. Courtney, program evaluator, 3 years now. Awesome. All right. Well, thank you all so much for posting all that in the chat. I see that, let's see, we've got, I'm going to open up the chat here a little more. Courtney, yeah, we've got a lot of folks that have a lot of experience and some that have just kind of started. So awesome. All right, well, let's go ahead. I'm going to close that poll and move to our acknowledgement slide. So we are here today to talk about the Epi Toolkit, getting the lay of the land, the Prevention Epidemiologist, and I'm Nicole Shaneborn. Our acknowledgements are that we are a SAMHSA funded grant, and this is done on behalf of SAMHSA. However, the views that are expressed by me or any of our team today are not necessarily the views of SAMHSA. And that kind of sums up that whole slide. So if you're curious about that, though, you can always email us at pttc6@ou.edu to get more information. So as I said, I am Nicole Shaneborn. I'll tell you a little bit about myself, and then I'll introduce some of our great team members that are here today that have also been super instrumental in this project. So my background is academically in psychology, specifically research psychology, and then went from that sort of really academic focus to landing a job in the state health department, where I worked there for 13 years as a program coordinator and evaluator for the HIV treatment and care division, as well as prevention. So I did a lot of training of HIV case managers and sort of set up that system. And then decided to make a little bit of a career shift and went to OU, where I worked for the CAP for several years. Some of you may know the CAP as their state and tribal liaison, as well as did some work with Service to Science for a while. So, and now here I am at the PTTC as the evaluator. So I'm really glad to be here today. I have a lot of experience that is relevant to EPI related tasks, even though you'll see my title is evaluator, which I saw many evaluators join us. And that is really typical, I think, in our field, that there's a lot of overlap between the two. So I did a lot of work with data work groups with HIV, and Bev, who I'll introduce in a minute, Dr. Tremaine, and I have done countless trainings and technical assistance related events around epidemiological tasks related to being in the prevention field. And so that's kind of my background and why it's relevant to today's Lunch and Learn. So I would also like to introduce our staff member, Dr. Tremaine. She wants to say hi.
Sure. Hello. It's nice for all of you to be here on this afternoon as we talk about my favorite topic, epidemiology. So
thanks, Bev. And Bev is one of the authors of this toolkit and has provided so much information and resources and writing to this toolkit. So we really appreciate having her here today. She has been very instrumental in getting this thing to be what it is. And she and I have, as I said, have done a lot of training and TA together. So Bev, did you want to say any more about your background?
Yeah. So my background is in evaluation and quality improvement. My degrees are in community health, public health emphasis, epidemiology emphasis. I serve on the PTTC as the epidemiologist, and so I help people to like data and enjoy using data. And so I also do evaluation, and just really interested in how we can use data for good to help solve problems. So.
Great. Thank you, Bev.
Uh-huh.
And we also have with us our fabulous tech team who makes this all happen today. And if you all are on your camera, go ahead and wave. We have Wanda West, we have Richard Feinberg, and we have Dia Caldwell, and we have Lori Smith. So we really appreciate all their help in getting this thing going today. There's a lot that happens behind the scenes, and I always feel well supported when we get on these events because we have this great team behind us. So thank you for being here today to help. All right. So during our lunch and learn today, I want you all to feel comfortable. I know this is lunchtime for many of you. Feel free to have your snacks, have your coffee. And if you want to join in and open up your line, that's great. Or you can use the chat feature. But this is going to be a pretty casual environment today. We know it's your lunch, so ask questions at any time. I see you all using the chat really well already, so we appreciate that participation. And most of all, we want to have fun today. So we know that epi tasks sometimes can seem daunting, and it's not always what people consider to be the most fun, right? Although the epi and evaluators here today probably would disagree with me, right? So data can be fun, and we want to really embrace that idea that we want to use data to help make our decisions in prevention. And really, when we use it effectively, that allows us to have more fun with the data, right? It's not as stressful. So eat and enjoy, and feel free to ask questions at any time. If for some reason we don't get to your question, you can always raise your hand using the Zoom feature, and that will alert us that we forgot to address your question. All right. Any questions about the environment today before I move on? You're free to post those in the chat. I'll just keep an eye on that real quick. Looks like we're good. I don't see anyone with questions so far. So again, use that if you need to, if you have questions. All right. So today, I want to encourage you all to be the epi superheroes I know that you are. I know you've already done a lot of work in this area, and we value that work. If you have experiences that you would like to share, please share those, because Bev and I will admit, we do not know everything, okay? I think that's the most important thing to know when you work with data, is that there's not any way possible you can know everything about epi work groups, data, et cetera. So keep an open mind, we will too. And post resources that you've found that would be helpful for us in the toolkit in the chat as well. So by the end of the lunch and learn today, these are our objectives. We expect that our participants will be able to navigate the components of the Epi Toolkit. And again, that is available in the chat. Dia has posted it there for you to download if you haven't downloaded that. We also will examine the epi role and the function within the state or local epi work groups. And then we also will ask you to identify one way the Epi Toolkit can assist you or your organization with epi related activities. So be thinking as we go through the content today, what's a way that I can apply this in my organization? What epi superpower do I want to have? because we're going to come back at the end today after we looked at the toolkit and really discuss what Epi superpower, if you had to name one, would you want to have right now based on your situation. All right, any questions about the objectives? And I'm going to check and make sure I didn't miss any chat here. Looks like we are good. Any questions? Give you a minute. Not seeing anything in the chat. All right. So a little bit about the background and purpose of our toolkit. And I know many of you may have partnerships for success grants or other grants that do require epi-related activities, or even sometimes specify an epidemiologist or evaluator as key personnel. And so there's a lot of challenges that we experience, right? Working with epidemiology in the prevention field. So part of the background and purpose of this toolkit is over, gosh, I want to say maybe like 10, has it been 10 years, Bev? Probably somewhere around there, that Bev and I have been working with states, tribes, and communities and epi work groups. What we tend to see is that, epidemiologists, their academic background tends to be focused on, that traditional infectious disease investigation procedure. And, the academic background may not necessarily totally prepare one for the work as a prevention epidemiologist. And so that makes it difficult also for you program administrators that are out there today, program coordinators, to know how to help the new prevention epidemiologist, even if they have experience as an epidemiologist in another area, such as, let's say even COVID-19, right? So this toolkit will help you identify things that you can access and help prepare you or your staff for that sort of new kind of shift for that work in epidemiology. So we also have the issue of the Epi work group, right? So the other thing that prevention epidemiologists may not have as much experience with is knowing how to sometimes coordinate the Epi work group, right? So sometimes one of the co-chairs is actually the epidemiologist. And so knowing how to facilitate work groups, knowing how to keep things on task, those don't always get covered in your academic background. And so often the prevention epidemiologist is faced with, oh, wow, I've got to do minutes and an agenda, and I've got to figure out how to communicate to these different partners. And it can be a daunting task when you've got that more technical background, but you may not have that background to like pull in people from very different areas. So you also have to talk to those data owners, right? And they could be from the coroner's office, they could be from another agency, it could be from law enforcement. So you really have to kind of have that ability to navigate all those relationships and get all of those partners at the table. So that is where we came from with this toolkit. And Bev and I have spent a lot of hours sort of just, thinking about and brainstorming what is the most important for this new epidemiologist in prevention to know, and what do their administrators need to know to help them. So that's where this document comes from. It comes from that perspective. And I want to honor the work of all of the epi work groups and epidemiologists that we've worked with over the years, because without our experiences in assisting them and guiding them through those processes, we wouldn't know what the challenges are. So thank you for all your hard work. So Dia has posted in the chat here just some questions to get you all talking about your experiences. What are some challenges you have experienced with epi-related tasks in your own grants? So you can go ahead and put those in the chat, and then any information about how you are hoping the toolkit can help you with those challenges. So as you're thinking about your own challenges, you can post those there in the chat, and I'll keep an eye on that as we go through today. All right. Before we move forward, just make sure that you all have downloaded the toolkit, because we're going to do a walkthrough. And Dia has posted that up there in the chat as well. All right, Danielle, access to data. Okay, yes, that's a big one. We will go over in the toolkit in a minute some data sources, as well as, talking to those data owners and how to access that. Jordan says challenges in getting consistent participation from the work group members in rural communities. Yes, that is a big one. It's really hard to know how to engage different populations. And so thinking about your audiences and what ways you can engage them is extremely important. Up-to-date data. Oh, we all want that, right? Sometimes it takes a couple years, as you all know, for that data to be formalized and cleaned and where it can be used. And so it's sometimes hard to access up-to-date information. And so working with those partners that you have in the Epi work group can be really important. There may be data that's not necessarily published online that maybe you can access in a more real-time fashion. So working with those relationships is important. Danielle says participation from work group members. Yeah, and engaging the Epi work group can be a challenge, and making sure that you've got those policies in place. Bev and I have worked with a lot of organizations on those Epi bylaws and policies for work groups. And that's where you can specify, okay, we need you to attend this % of this many meetings, or we may have to, look for somebody else who can fully participate. Deanna says getting local data, especially on smaller subsets and populations that may have specialized needs. Yes. And often we look at those overall data sources that may be published again online and more standardized, but then we have to also know how to go a little deeper and go get that local data using some qualitative information with focus groups and key informant interviews. Okay, and getting military data. Yes, that can be difficult as well. Just seeing if I missed anything here.
Yeah, Nicole, there's one, Hillary Joyner writes about doing work in tribal communities, and I think always looking at qualitative and quantitative data as which is more appropriate, and not that quantitative is better than qualitative. In some instances, there's qualitative is better than quantitative. Listening circles instead of a survey, key informant interviews. And I would always say, promote your reasoning to your funder to say, in our situation, we feel that this methodology, which is seen as, a great methodology, we feel this would be appropriate to get the information from the community in a way that is appropriate for them. So I would always, promote it as we're choosing the best method instead of, quantitative is a better method than qualitative. So just
exactly.
that.
No, thank you, Bev. And that's a really important topic. And often, we won't talk as much about that today, but, mixed methods are often a great way to make sure you get a comprehensive picture. So even if a funder may require the quantitative, making sure they understand the value of the qualitative and how that informs even the quantitative data as well. But yeah, many times, qualitative data may be the more appropriate based on the context of the situation. And so being able to communicate that even to your stakeholders and your Epi work groups is really important. All right, well, thank you all. And now we will talk about the content of the toolkit, and we will move into the walkthrough. So the content of the toolkit centers around first the organizational structure and the EPI's role within the prevention system. And then we move into talking about how to work with the Epi work group and go into some of those challenges and maybe ways to address them. Identifying and communicating data, which we just talked about, is really important, especially knowing your audience, knowing the population. You may have to talk to a legislator, and you don't want to send them a 80-page report, right? So you've got to figure out with your audiences what is going to be the most appropriate to get the message across that you need to get across for your communities. So, and then we talk about the strategic prevention framework and the Epi workgroup tasks. The strategic prevention framework being our kind of framework for prevention that we follow with just for those of you that may be new, we've got assessment, capacity building, planning, implementation, and then finally evaluation. And so connecting the dots between your Epi group activities and the steps of the strategic, it's a mouthful, prevention framework is really important. And then finally, we talk about the tools and resources that are available to you, both from the PTTC and other additional sources. So any questions about the overall content of the toolkit? It looks like we may have some feedback over here. I'm just making sure I didn't miss anything. Great. Yes, and Bev has posted a resource there on Indigenous philosophies and data collection activities for those of you that are interested with the link. Thank you, Bev.
Mm-hmm.
All right, so we are now at the toolkit walkthrough, and we will go ahead and post that toolkit one more time. Thank you all, team. Unfortunately, with Zoom, we have to keep posting the links, but we work with it. All right, so what I am going to do is go ahead and take you to the toolkit. In my Zoom, there we go. All right, so we now have our section 1, and that goes over the organizational structure. It covers the EPI's role within the prevention system. And within each of these chapters or sections, as we call them, you will actually see tips at the front for those of you who may have more time constraints. I understand how that is sometimes. You've got to get right to the meat of it. But we do have a check sheet of tips right at the beginning of each section if you don't have the time to look at all the other information. So that will at least give you kind of an overview of what you're looking at. And make sure we have this big enough too for you all. Hopefully you can see that. Okay. And we go into, in the first chapter, we go over the continuum of care. We cover just some basic things that as EPIs, you may not have been exposed to if you have, that traditional background. And so this is really important to prevention, where you're going to have your promotion phase, your prevention. You may have heard about universal, selective, and indicated, and then treatment and maintenance. So you're going to be in these work groups, and I'm a prevention specialist, so I can say this, that our prevention specialists tend to start talking in the terms we know, and you may be like, what is universal, selective, and indicated? So what we have done is we've gone through a lot of these terms that you might hear from prevention specialists and in your work groups, so that you're more aware of what to kind of expect and get that terminology under your belt. I won't go through all of them, but just know that that's here. And you can go back and look at it. And then we have all the different grants that you might experience. More keep being added every day. So I'm not going to say this is an exhaustive list, but these are some of the major ones. The Substance Abuse Prevention and Treatment Block Grant, the Partnerships for Success, And it kind of goes over what those are about. There's also tribal funding. And then we go into the prevention system infrastructure. So what can you expect to see? And this is going to vary by context. So this is one state example. There are many others. There are also tribal examples of structures. And so we even have in Oklahoma, the state of Oklahoma actually has a combined state epi work group and tribal epi work group. So each area is going to be a little different. So getting to know the prevention director is really important, because your prevention director is going to be able to talk to you about all of these things, and sitting down with them and having a discussion about the structure is going to be one of the first things you want to do, so you know where you fit within that system. So we have a nice chart here, and I want to give some kudos while I'm going through this to Sheila Boswell, who's done all the amazing graphics throughout this toolkit. So thank you, Sheila. She takes our nonsense and makes it into something pretty. All right, and then we go over each of those levels. We go over the important roles of the EPI. You also want to make sure that you're really watching that one agency doesn't dominate the membership, and we've kind of highlighted that here. We've seen that happen with the EPI work groups, especially where you may have one agency that's kind of dominating the meetings. So really getting, making sure you kind of map out what players do we need at the table? Do we have a well-balanced group? It's going to be really important for your success. And we talk about the EPI work groups, the tribal EPI work groups, and what they focus on to give a broad overview. The EPI profile, which is going to be one of your major products. And then we do talk a little bit about the evaluator versus the EPI role. Some states and tribes, that's sort of a combined role. So again, it's important to talk to the director, your stakeholders, and find out what's kind of expected of you. Are you doing the surveys and doing the EPI related tasks? Do we contract that service out? Is there, an epidemiologist that's a hired internal staff person? Do we hire out for the evaluator? All those things are really important. And then the big focus is data-driven decision making. So really, I would say, and Bev would probably agree, this toolkit is really about you all making sure that you're making decisions based on data.
Yeah.
Right, Bev?
Yeah, absolutely. Yeah. What is often said is, if you just have an opinion if you don't have data.
Right, exactly.
So, yeah, you need to have your data and talk through that and show your rationale for why you want to go in a particular direction.
Yep. And you save yourself a lot of what I call heartburn if you do that later. It sometimes is more work up front to plan, yeah, but in the end, it's much better. All right, and then at the end of each section, just to give you kind of a frame of reference, we'll have the references section. That was kind of a pun, wasn't it? Frame of reference, here's our references. But we wanted to provide you with references at the end of each section, just in case you want to kind of take this piece by piece, and you may not have time to look at every section in one sitting. And so the references for that particular section will follow right behind that. We also, throughout the toolkit, if there's something really important that is something that we want you to have right away, based on something we've stated in the text, you'll see these little pop-outs called Get Resourced. So that is just a clue to you, hey, this is a really important thing for me, so I'm going to go take a look at that. So we've also created pop-outs for those. So, all right, so section 2 is all about the EPI work group. I think probably of all the sections, I would say this is where the EPIs will probably spend a lot of their time. just because this is such an important task, and it's really the most complicated. You all have that technical background to know how to analyze data. You have great resources, but this is where some of those soft skills become really important. And so working with those stakeholders, getting your partnerships, and Sheila created this nice graphic for us that just talks about promoting high quality prevention services, all the different pieces of that you may not realize go into your role. So we've got advocacy, we've got communication, development, leadership, involvement. And people are really looking to the epidemiologist as a leader in this instance. So a lot of these players when at your Epi work group are not going to be as familiar with data as you are. And so they're looking to you for leadership.
Yeah, and Nicole, just I want to insert, don't underestimate the fear of people you're trying to engage as stakeholders around data. That can often interrupt your sustainability with your groups. Some people fear data, they don't know how to work with it. And so they're just, you know, when people don't understand something, they typically don't want to be involved in it. So you might need to do a lot of extra teaching and education and awareness building that, you know, data is your friend, and it's going to help us develop our program here.
Exactly. Thank you, Bev. Yeah, it can be a little scary for some folks. So making them feel comfortable is going to be really important. Okay, and then just looking at the structure materials, and I know I'm going through these quickly, just to kind of give you all an overview. I know we don't have a lot of time today, but there's some information on collaborating effectively to share the data. And we do have some templates also throughout. So you'll see here a collaboration analysis chart. And this is kind of what we were referring to earlier, where you can look at the different partners and assess, do we have these folks on our Epi work group? And if we don't, how can we reach out? How can we strengthen those relationships? And this also looks at the strength on a scale 1 to 5. How strong do we feel like that relationship is? And then looks at the gaps. So this can be a helpful tool to say, hey, some of you stakeholders on our Epi work group that maybe have really good collaboration skills, can you figure out how we can reach out to these partners and build our Epi work group to be really strong? So there's an example of our Get Resourced. So this is a Get Resource tool for working effectively with tribal governments. And so that's just an example of one of the ways we call out some of these tools throughout the text. Then we also have some information on facilitation, how to lead group discussions. So that's some information on how to boost your skills there. And then also how to evaluate and sustain your efforts. So again, we've provided a resource here, the fundamentals of evaluating partnerships from the CDC. And this is an example actually that we adapted from that tool to fit Epi work group activities. So feel free to use this as you can. It's just an example of something that you might do. You know, what evaluation questions do we need to ask? What are the measures? What are the data sources we have? How will we collect the data? What's the time frame? And then this also can give you some feedback as to what data sources are we missing? And we really want to look at this measure, but we don't have a data source for that yet. And then how to communicate it. So it's just a way to lay that all out. All right. So I know that was a little bit of information so far. So I'd like to pause and just before we go into the next section, ask if you all have any experiences associated with the Epi work groups you'd like to share, some challenges, questions you have about those sections. I know we moved through them quickly, but I just wanted to pause to make sure and provide a check-in. So I'll wait a couple minutes and see. And Dia's posted, what are your experiences with the Epi Workgroup? And that may take a bit for you all to answer. So I'll keep an eye on the chat as we move through the toolkit. It looks like no one is asking any questions, so I'll assume that we went through that okay, and that we can keep moving on. I'll keep an eye on that chat, and Bev will as well. So if there's a question about Epi work groups, she'll keep an eye on that too. So identifying and communicating data. Another big one for the epidemiologist. And honestly, I still struggle with this one sometimes. So, we have to do our homework and our research to figure out what's going to be the best for the particular group I'm going to be talking to. Do I need a short elevator speech? That's, 1 or 2 minutes while I've got a legislator in my elevator, so to speak, to get my point across about some data? Or do I need to have, a fact sheet? Do I need to do a video like we're doing today? So today we're recording, and we're going to make a video and post this on our website with the toolkit as a tool for those who weren't able to be here today. So thinking about what's going to be the most helpful, how do we present it? How do we connect with certain groups? That's what this chapter is about. And again, we provide the tips and the get resourced. I do want to highlight this resource in particular, the SAPS, our Substance Abuse Prevention Skills Training. It really provides that foundational training that I feel like anyone in prevention can benefit from, even an Epi. And I know Bev, when she came on, she said, I'm going to take that, and I think that says a lot when you have an epidemiologist that cares a lot about the subject matter, that they want to know. They want to know what everyone is experiencing. They want to know what the prevention specialists are having to learn. They want to be able to speak prevention. And so I encourage you all as administrators, you all as new prevention epis, and even those of you that have been in the field but may not have had time yet to take the SAPs, I encourage you to seek that out and talk to your supervisor to see how you can get enrolled at a SAPs. It's just such a great overview for all that is prevention. And then we also have, our PTTC has several resources, and so those are highlighted throughout as well. The next part, and I did hear some folks say data sources, right? So we do have a section on the major substance abuse prevention data sources. And of course, there are many more. And there is no way we could list all local data sources. So that's why it's important to have those local stakeholders that you develop those relationships with. But many of the main ones that are published online or are governmental data sources are in the toolkit for your use. Mm-hmm. We just wanted to make sure you knew that was not an exhaustive list. So go ahead, Bev.
Nicole, I just want to insert here, if you haven't already, I would open up an Excel document after this webinar and start collecting your own data sources so that you always have an ongoing repository of data sources out there, the weaknesses, the strengths of them, the populations they deal with, if they're free or paid or whatever, the links to access them, and build that as a person who focuses on data. That will serve you very well in your search for making sure you have everything that's possibly out there in the universe. And it'll give you a sense of calm because you have that to refer to. I wouldn't continue on just like, I find a data source here, I find a data source there, and then you use it, but you don't constantly have that foundation of a document that says, these are the ones I've collected so far. So just a tip to, get your house in order in that way.
Thanks, Bev. Yeah, that's an easy way to organize and get started on that task. And we all have to do that. It's sort of like our own cheat sheet to all the data sources. When you live in a particular area, start that customized list. You know, take these sources and start with those and then add to it as you go. Thanks, Bev. And then here we talk about different stakeholder groups, and that sometimes we don't think of, including businesses, media, law enforcement, you know, the YMCA. These are going to vary based on, you know, if you're a community epidemiologist, a state epidemiologist, tribal. They're also going to vary based on your location and the context. So reach out to those stakeholders, and sometimes it'll be surprising to see who will step up and say, you know, I'll help, or I've got this data source that we may not have known about. Dissemination. So think about, you know, again, do we need to develop a data storyboard to increase engagement? Bev has a lot of experience doing that. And later we will put up a request link that you can submit if you would like some more intensive TA from our staff or an expert in the field. But a way to engage folks in the data processes, sometimes you have to do a storyboard, or again, a legislator is going to have different needs. And so looking at the best way to disseminate that data to those different audiences. And again, the last quote is great. We don't want the Epi profile to sit on the shelf. We want it to be a dynamic document that people live and breathe and use. And so making sure you engage those audiences. And this quote, you know, it just really, I think, hits home. Decide that communication is part of your job and learn the rudiments. It's easier than epidemiology. Well, sometimes, but, sometimes it's easier, but I would say, yeah, it's not as technical. And so it's important that you learn how to focus on those communication skills. So we've got some steps you can take here that we've outlined in this graphic. And there are things sometimes we know, but we kind of have to be reminded sometimes. Tell the people who are most affected what you have found and tell them first. That's a big one. And in my experience, even at the health department, that was a lesson I had to learn sometimes, is that I might want to go tell, you know, a legislator first, but really who I needed to be talking to first was the people that were most affected by the data. You know, which community this was in. They really need to be told first. So it's really important for you to look through these tips and just remind yourself, you know, what's important in terms of the communication here. And then we have our references. Section 4 is on the Epi Workgroup tasks and the Strategic Prevention Framework. I won't go through the Strategic Prevention Framework because a lot of you are probably familiar with that. But again, going through the SAPs will really help you with that. And Wanda did post a link earlier to the pre-SAPs, which is an online portion. That's a little shorter. And so you can go through that first, and that will give you a little bit of background, and then try to get into the in-person SAPs. So we also go through how the steps relate to Epi work groups. I won't go through all of those, but that kind of gives you the links between the two. We talk about expectations and then action steps for those. And I think what I'd like to highlight, and Bev has done a spectacular job actually implementing this with several clients. So using your logic model with your Epi work group as part of the SWIFT process. And often we don't think about using a logic model in epidemiology or with the Epi work group, but it actually has really been a useful tool for many organizations. So just an example, you know, of what your inputs might be, your activities and outputs, and then the outcomes. And so you could work with your Epi work group to establish what those would look like for your own agency. So then we provide a blank sort of template here where you could outline that with your activities, in Q1 through 4. And again, that's just a template. You can modify that how you see fit. So any questions about that part? I know we're getting closer to time. I thought I would just run through this quickly, but I love all the discussion we're having. So
we made it long, Nicole.
Well, I always tell people that when I don't have people to interact with, like if I'm just rehearsing, things go a lot quicker, but I am a farm girl from the Midwest. So when I get talking, sometimes it doesn't stop. So
it's a long document, but it's got a lot of good stuff in it.
It does. So I don't see any, doesn't look like any questions. So I will go ahead, and this is the last section. So these are the tools and resources to get you going. It talks about how to request TA, and we'll give you a direct link for that here in a little bit. But just to emphasize, there is no wrong door with us and requesting TTA. We will give you a quicker door with, with the link here in a little bit that helps us focus in on what it is you need. So just know that you can request that on multiple ways, including by talking to our staff, requesting it through the website, etc. So, and then we go over what the PTCC has to offer. And I think this is probably really helpful for some of you that are thinking, what do I even request? What are some typical things that we can request from the PTTC related to Epi work? So these are some examples, definitely not an exhaustive list, but it does kind of help you get started honing in on what it is you need, and that will help us better design TA for you as well. So that's available. We also have all of our products that are related to data and epidemiology and how to search for those listed in the last section. So that's going to be where you can go to look for additional resources and go check those out. We have a lot of recorded webinars, we have products, and with the PTTC, what is nice, you can access resources from all the regions, not just ours. So on the website, you have that all available to you. And then in the back, we have our, in our appendix, we have the outlines for the Epi profile. And then we also have the bylaw example that might be helpful. And then we also have the logic model template. So that's kind of the overview. And I know it's a longer document, so I tried to do that quickly. But if you have questions, again, please post those in the chat. And we'll be having some discussion here in a minute too. Questions? And while you all are doing that, I'm going to go back to the PowerPoint here.
That's an adorable picture.
Right? I thought so too, And shout out to Dia, who had this great idea about the Epi superpowers. I had one question in here, but we really kind of had a theme going after we thought about it, and it really is a superpower. So let's go ahead and talk superpowers now. So Richard, I think we have a poll. All right, which Epi superpower in the toolkit would you like to have right now if you had to pick one? So we'll let you answer that. And I'm just going to see if I guessed right after we see these. All right, so looks like knowing how to present and communicate is winning out right now at about 40%. Yeah, with the Epi, how to work with the Epi work group behind that, just, about 10% behind that. So, all right. Well, it looks like we have most of you participating now, so we'll share those results. And we've got, again, knowing how to present, communicate, being the most likely superpower you need right now. And then following that, working with the Epi work group, then knowing the infrastructure, and then understanding the SPIF. And I would have guessed either the Epi work group or presenting and communicating the data as being the most challenging. So I think I was in line, although I probably was leaning more toward the Epi work group. So that's interesting that you all want the presenting and communicating data as your superpower. So, okay, and so now just a little more discussion. We have in the chat, if you would like to tell us about why you selected that as your superpower, and how you feel like this toolkit can help you achieve getting that superpower. So if you feel like sharing there, we have that question posted in the chat. All right, and in the interest of time, as you all are typing in there, I'll just go on to the next steps here, because I think it's probably going to relate to what you suggest as your superpower too. So in terms of next steps, so this is, what action are we going to take from this lunch and learn? What are some things we can do in the next few weeks to use this Epi toolkit? And this could be as simple as, I'm going to download it and I'm going to share it with staff. So anything that you can think of that you're going to do in the next few weeks to use this Epi toolkit.
Nicole, while they're thinking, it's a good idea always as a professional to go back to the competencies of your profession and look at those competencies, and anything that has to do with data, look at how good you are at that, and maybe use that as a check sheet of, am I good at this? Am I not as good? Do I need to increase my skills here? I'll put in the chat box where you get those competencies, and systematically try to reduce your maybe I wouldn't call them weaknesses, but your future strengths of what you need to do better at, and so it's more organized in your approach.
Awesome, thanks. Yeah, we'll think of those, as you said, not as weaknesses, but what superpowers do you want to get?
Yes, absolutely.
Awesome. Thanks for posting that in the chat. And I see a few action steps here. My next regional Epi work group is in a couple of weeks. I will make sure to use some of the tools and ensure we are on target. Good. Data is my strength. Making the row focus tends to drift with a vast interest by participants. Yeah. Keeping interest is so important. And even looking at ways to engage audiences that may not be in the Epi field, you can look at other ways to engage audiences to help with that. So yeah, use that toolkit and check out those resources. Thank you, Mindy. All right, so if you would like more intensive help with any of these things, or as you go through the toolkit, I saw someone said they were going to use the toolkit for inspiration too, and figure out what might be the best way and go look at it. So as you feel inspired going through the toolkit, if there's something you feel like you need more help with, we've got a link here, and we're going to post that directly in the chat as well. Thank you, Dia. And that way you can request TA. It's just a simple form, it doesn't take long to fill out, and that will let us know what to focus on, and we'll give you a call back or email within a week to see how we can best help you. So feel free to use that as a resource as you're going through the toolkit. And then we also have our additional resources for today's Lunch and Learn. So there's a lot of great ones here too. All these materials will be sent to you, so don't worry about writing any of these down. But self-paced online courses, we've got a mini series on collecting data during the pandemic, which focuses on both quantitative and qualitative data. And then also our PTTC network has an incredible work group that Bev's a part of called the Data Informed Decisions Workgroup. And on their page are just a wealth of resources. So please check out that page. I know it's just one link there, but if you go to that one link, you will have a plethora of things to look at. So check that out as well. And we are at that time today. We know that data is important for decisions, right? So here is our evaluation link to tell us how we did today and anything else you would like to see or things we can do better. So the link will be posted in the chat there. And then you also can use your phone, your camera, and scan that QR code to bring up the survey. So I'll leave that up a little bit here. And again, that's posted in the chat there. And Wanda, when we close out today, that will come up as well, right? Awesome. So yeah, when you close out today, if you didn't have a chance to click this now, it'll pop up for you. Please fill that out and that will help us plan our next events. And lastly, here is my contact info. If you would like information, anything regarding the Epi Toolkit, feel free to email me. We also have our website there. Please join our mailing list. If you're not on it already, you'll get information about our upcoming events sent directly to your email. And then also check out the PTTC products and resources. And again, in the toolkit, we tell you how to specifically search for the data and Epi related products on the PTTC webpage.